Hello, everyone. I want to say that it's just a pleasure to have everyone here today. Today's discussion promises to be very enlightening. We've all learned a great deal over the past 16 months as a result of the COVID pandemic. We're really inspired by the work taking place within Chicago and wanted to dig deep into the specific challenges and solutions impacting hunger and nutrition equity within this community. To help us get started, we have a special guest who will be providing opening remarks on this topic. Tiffany Rendon, a 5th grade student at Dawes Elementary in Chicago, will be introducing our next guest.
Hello, my name is Tiffany Rendon, and I am a 5th grader at Dawes Elementary School in Chicago. It is my pleasure to introduce Dr. Janice Jackson, the CEO of Chicago Public Schools, who will be providing opening remarks today before the panel discussion. Exploring Nutrition Equity in Chicago. Dr. Jackson is a former student, teacher, principal, network chief, chief education officer, and now chief executive officer for Chicago Public Schools, the nation's 3rd largest school district. Throughout her career, she has been a forward-thinking educator who has believed in setting the bar high and has focused on improving equity and access to high-quality education in Chicago Public Schools. Her leadership and the efforts of Chicago's dedicated teachers and principals have propelled CPS students to record-breaking academic gains and have caused education experts across the country to regard Chicago as a national leader in urban education. Please join me in welcoming Dr. Jackson.
Thank you, Tiffany. I was just over here beaming like a proud mom or aunt listening to you. So proud of you and your peers over at Dawes Elementary. Thank you for taking time out of your day to do that wonderful introduction. I also want to thank Common Threads for giving me an opportunity to offer some remarks here today. As Linda knows, this is an organization that's near and dear to my heart because of the work that you do each and every day on behalf of students in Chicago Public Schools, and really for the unique ways that you really lift up our mission around equity. When we talk about equity and access, oftentimes we focus on educational equity and access to high quality programming. But what you really lift up is the importance of our students being healthy mentally and physically, and the role that nutrition plays in that. And so I've been so thankful to witness this program grow over time, to participate and see the value of it as a school leader, a district leader, and now in my role as CEO. So it's an honor to be delivering opening remarks today. As many of you may know, my time at CPS is drawing to a close in a couple of weeks. And, you know, again, it's bittersweet, and events like this really drive home the importance of all of the work, sacrifice, and just toil that has happened over the past few years. And so I'm incredibly proud of this partnership because it really did help me to meet one of my goals, which is to make sure that every student in Chicago Public Schools had a shot, had an opportunity to attend a high quality school, and have everything that they needed holistically in order to access that. And so as a school system, in addition to focusing on academics, we began by prioritizing social emotional learning, recess, physical activity, and bring in learning gardens to our schools, because we know that when students really have that experience to create something and watch it grow, it can be transformational in their development. We then brought more healthy food options to our buildings with the help of partners like Common Threads, and we expanded cooking and nutrition education in our schools. And I have to tell you, again, witnessing those programs, seeing parents come together, work directly with their children, take that learning together and take it back to the home has really been heartwarming. And so thank you for your continued advocacy and for, once again, the unique ways you help to lift up our communities. Since launching its first program in 2004, Common Threads has reached more than 160,000 students, parents, and educators in Chicago Public Schools. I have, again, seen the programs in action, and the level of engagement, especially from our students, is incredible. And I was a high school principal, so I know how transformational and how hard it is to get kids to engage with their parents, especially after a certain point in life. But teaching them about nutrition from the beginning, about nutrition, is only the beginning. We're really giving them a chance to learn how to take care of themselves and create a lifestyle that I think will drive, stay with them throughout their entire lives. And we know that this will not only help them have more healthy lives, but improve quality of life, as well as the longevity of life, which is, again, another equity issue that so many of us are fighting for on the front lines every single day. But I have to say that this experience is more than just about food. It's really about celebrating the diversity, cultural diversity in our families. And that's one of the greatest assets of this district in this great city. And if you want to get people to start talking about their culture, typically food is a good start to that. Lastly, I just have to lift up the amazing work, which I know you're going to talk about today, through what we learned in the pandemic. And Linda talked about this a bit in her opening remarks. We as a school system had to pivot very quickly in order to respond to the needs of our families. And food was at the top of the list. And, it wasn't lost on me as a lifelong educator. I know that many of our students depend on us for at least one meal a day, many of them 2 or 3. But once the doors of the school closed, there were a lot of people who didn't know where the next meal was coming from and were panicked in ways. And we know that when we don't provide high quality options, that people will go for what's there. And partners like Common Thread, because of the work that you've done, helping us understand the importance of health and well-being, the work you've done in our communities, really allowed us to address these issues around food insecurity very quickly. So thank you for that. And thank you for everything that you will do going forward. Like I said, my time as CPS is winding down, but I'll still be around supporting students and families throughout this great city. And I look forward to continuing to work with great partners like Common Threads throughout the city of Chicago to support our students and families. Thank you again for all the work that you do. And once again, it was an honor to join you today for this riveting panel discussion.
Thank you, Dr. Jackson. I've been doing this a long time. And I have to say that there are few educators or administrators who have the idealism, positivity, resilience, and compassion for children, families, and our overall communities. I've seen you in action and done many site visits, and with you, it just comes from such an authentic place. You're that person that people gravitate to, from teachers, principals, elected officials, but most importantly, what's always moved me is how you connect directly with the children and make each one of them feel heard and seen. As I said before, we had intended to honor you in grand fashion at our 15th anniversary chef takeover fundraiser last March. We did have to postpone that event due to COVID, but we are so pleased and grateful that you're able to join us today to share your perspective. And I want to personally recognize you for all you've done for the city of Chicago in your time with Chicago Public Schools. Thank you.
Thank you. Thank you for those wonderful remarks. It's been an honor. It's been an honor. Thank you.
Thank you. So we're going to get right into the conversation right now. So today we want to highlight the difference between food insecurity and nutrition equity. Children, 2 things to just stress. Children with overweight and obesity are more likely to become adults with overweight and obesity. And really, health starts at home, at the family table. And what children eat matters just as much as access to healthcare. So in a world where zip code matters and determines quality of life outcomes, supporting the overall health and wellness of a community should be a foundational investment that's of concern to all of us. Nutrition is a social determinant of health, and the work that Common Threads has been doing over the past 17 years really does contribute to health equity. Those who report very easy access to fresh fruits and vegetables have higher rates of eating 5 or more servings of fruit and vegetables a day. These individuals also report good overall health and have a lower prevalence of obesity and diabetes. Healthy cooking, healthy eating, and healthy living should not just be a life choice, but a human right. When you zoom in on communities within Chicago, you can see some of the differences we've been talking about when we talk about access and chronic disease. So life expectancy differences in Chicago and across the country are largely driven by increasing chronic disease among non-white residents. So we're talking about heart disease, cancer, diabetes, and infant mortality. So from this data, which came before COVID, which we know only exacerbated poor health in vulnerable communities, we saw that life expectancy actually decreased between 2012 and 2017 in all racial and ethnic groups except non-Hispanic whites. And we also know from the research that more than 231,000 Chicagoans have limited food access. And we know that many are clustered in neighborhoods in the south and west side of town. So imagine having to go to the grocery store without a vehicle, knowing you'll have to carry your groceries home or find space for them on the bus or the L. Ideally, 1 mile or less should be the distance to a full line grocery store so that families have the option to walk or take public transportation. But we know very well that many residents have to travel 5 miles or more to get to a proper grocery store. Poverty perpetuates poor health, and poor health perpetuates poverty. And so prioritizing solutions that address access to healthy food and healthcare in under-resourced communities is really so critical and needs to be part of the conversation when we talk about community development work, because these inequities have real consequences. So I'm going to jump in right now and introduce our amazing panelists. First, Jessica Matter from America Scores Chicago, Dr. Angela Odoms-Young from University of Illinois at Chicago, and Jaye Stapleton from the city of Chicago. Thank you, ladies, for coming and participating in what I know is going to be a very thoughtful conversation. So I'd like to open this first question up to all of you right now. In your line of work, what type of inequities in nutrition security influenced by lack of diversity, equity, and inclusion affect the Chicago communities that you reach for service delivery?
I can begin. So I think, exactly building on the graph that you just showed, Linda, we know that the communities that are most impacted by nutrition insecurity are disproportionately Black and Latinx. And what we saw in COVID is that those inequities were further exacerbated. And we know that people have intersectional identities. And so we also saw increased rates of nutrition insecurity with households with children, older adults, especially our seniors, and people with disabilities.
Does anyone want to also go into that?
I can add on to that a little bit, Linda. I think the other thing, not just this year, but in general that we see, so in our program, we work in schools and we're working with young people. And so it's really difficult for us to be able to try to provide health and nutrition education when our young people are not the ones that are making those choices, right? It's one thing to tell a third grader about fruits and vegetables and what kind of foods they should be eating, but if they're not the ones who are procuring food or cooking the food and often to all the other things noted here, they may not have access, resources, right? Healthier food is often more expensive. And so I think that's just one of the challenges when we think about that kind of equity and inclusion, that we're providing this education, but then at least in our capacity, we can't change the larger systems that are then creating that disconnect to the access.
So what are you hearing from families?
I can talk a little bit about that. From families, I think people are facing multiple challenges, and I want to make sure I emphasize that they're being resilient. Families are being resilient in the face of these multiple structural challenges. So sometimes we think about, families and we define them by their challenges, and really we should define them by their assets. So we understand that structures can be oppressive, and that's why historically they've led to these inequities that exist. But it's important to focus on what families have had to deal with and in some cases overcome. And so this year we've seen challenges where people needed to go to work and they couldn't work from home. So there's data that shows that Black and Latinx families, Indigenous families, when we look at Native American families, also in the same, live under the same conditions where many could not work from home, or communities that lacked access. And we have an impact on businesses within communities of color. So it ends up being very layered. And so families are facing challenges and they're figuring out how to make things work. And honestly, many are making things work. And so I think that's what we've seen this year, but we know that historically this has been something that's happened over many years, the conversation about the South and the West Side not having access to the resources that they need. And I think the other thing we've seen is community-based organizations, those traditional BIPOC organizations really respond to meet those needs, as well as Dr. Jackson mentioned, common threads, folks that have been working at the community level, responding to support families as we've dealt with this pandemic.
Thank you, Dr. Odoms-Young. Jay, can you talk to the next question of which policies seem to play a role?
Sure. So I think, one thing that was really highlighted in COVID is that our food system in Chicago is highly decentralized and touched by many different government agencies. And so we know that there is a need for new policies to better enable coordination, as well as dismantle some of those racist and inequitable structures that Dr. Odoms-Young was talking about. And so thinking about policies that enable equitable distribution of resources and opportunities, and also facilitate community engagement across the food system, I think are things that we know are needed at this stage and that were really highlighted by the past year.
So Jay, I just want to follow up with you right now. So what role do you think city government plays in uplifting local food systems that supply healthy foods in communities, especially for those most vulnerable to health disparities?
Yeah, so I think that there's a couple different roles that the government plays. So first is a convener and a coordinator with local food systems actors. So certainly, again, as Dr. Odoms-Young said, we could not do this without community partners and folks on the ground. And we certainly saw that in the COVID response. But I think that the government is well positioned to act as a convener and a coordinator, and also work with our counterparts at the state and federal level who are also touching the food system. So that's one role. I think the second role is that the city directly invests in the food system in many ways, as I was saying, whether it's through CPS, through our home delivered meals to our seniors, through our procurement practices. And so being mindful of that role and ensuring that investments are equitable and transparent is key. And then I think finally, facilitating, the city can help co-facilitate an environment that reduces barriers to innovation and amplifies community-driven solutions. So looking at some of the emerging best practices that we've seen from folks on the ground in our city and in other cities, and trying to hold those up and help promote those throughout the city, I think are some key things that we're focused on.
So what is the mayor's office doing now? And in your opinion, what else needs to be done?
So what we're doing now is, so there have been, I think we're building on a legacy of previous planning efforts that have been done. But we know what we've heard from community partners through our many different community engagement tables and through the Department of Public Health's health improvement planning process, which is a very rigorous and robust process that happens every 5 years, is that there needs to be increased transparency, and that the government needs to prioritize these plans and make sure that they have what they need to move them forward. So what the mayor's office is doing right now, in partnership with all of our city departments and sister agencies like the Chicago Public Schools, is working to create a food equity agenda. So that is being done in partnership with our community stakeholders. I think that that is a key thing that we want to center throughout this process. And so we hope to be releasing what that food equity agenda is soon. And in addition to that, we're also thinking about, how are we prioritizing and resourcing that agenda? And so in partnership with the Greater Chicago Food Depository, we will have a staff member in the mayor's office who's a food policy lead who will really be centering that work and helping to collaborate across and within city systems, but also with our community partners and that Food Equity Council. And so I'm happy to share more about that and some of our key priorities under that agenda, but I'll pause there because I know we have a lot of good questions to get through.
Just one more question for you, Jay. I mean, I really do appreciate the work that you all are doing as we work across the country. Actually, close to half of the participants today are from other communities across the country. So just really quick, what are some of those initiatives that you think would be translatable to other cities and communities?
Yeah, so building on what I just said, I think two things. So one is centering and empowering communities. So as I mentioned, through the Healthy Chicago 2025 planning process, we took that feedback from community partners. We're trying to act on that. Our Department of Public Health just released an RFP for community partners to lead health equity zones. So we're very firmly centering equity within our health planning process and resourcing community-based organizations to define what the needs are within their communities, because we know the needs are different from community to community in the city. And so I think that that is one initiative that definitely would translate to any city. And that was also informed by some of our early equity work around COVID vaccines and COVID testing. And so we're really proud of the accomplishments we've had there. We have the most equitable vaccine distribution in the country. And so we want to look at the structures that made that happen. It was very intentional, could not have been done without our community partners on the ground, and then translate that to other health issues like food equity and food access. So I would say that is one piece. And then the second piece is intentionally structuring the government to support the food equity agenda. So as I mentioned, we will be housing a food equity policy lead directly in the mayor's office. And we actually looked to some early leaders in this space. New York and Baltimore also do something similar. And so I would say that's another initiative that we would hope to see other cities emulating as folks are thinking about these food equity issues.
Thank you. Jessica, how does America's Scores support your children that you work with who participate in one or all of your after-school programs that are also in need of healthy meals, snacks due to food insecurity and or other challenges?
Yeah, absolutely. And so with America Scores, so we're an out-of-school time program that harnesses the power of sport, spoken word, and service learning. We work with K to 8th grade students in schools throughout West and Southwest Chicago. We also, in addition to our program, will bring in program partners in some of our school spaces. So we've worked with common threads in almost all of our partner school spaces this year. And just as a shout out to y'all, it's been one of the biggest successes of all of our programs this year, and our families have really enjoyed the family cooking nights that we've been doing, as well as obviously getting that access to food. But in terms of our sort of program and our curricula, within that physical activity, literacy, and service learning programs, we have health and nutrition lessons and activities embedded into everything. So that for all students, kindergarten to 8th grade, we're really focused on helping them build those skills that are needed to create those healthy habits and learn to make healthy choices and really understand the connection between those healthy choices and their overall physical, mental, and emotional health. So while we may not be increasing access to food or necessarily providing food outside of snacks in our programs, we're really working to, I think Dr. Jackson mentioned that the lifestyle and kind of helping to cultivate that healthy lifestyle. And zooming out even further, as part of our program design and our coach training, we're really focused on creating healing-centered environments for our young people to help them work through the chronic stress and trauma we know they're experiencing, food insecurity and inequity being such a big factor of that. And so we're really focused on creating spaces where our young people feel safe, they feel supported, and they have the space to kind of heal and learn to kind of regulate that stress that we know they're experiencing day in and day out, for many of which due to food insecurity. And so again, we're looking at really those short and long-term impacts on health, and kind of working to address those through our program, as well as working with partners like Common Threads to bring in those resources that we may not have the capacity to provide, but that we know are really needed.
Thank you. Dr. Odoms-Young, this one's for you. So when it comes to Chicago communities, how do we improve programs to reduce those inequities in nutrition, and specifically when reassessing cultural norms around what is healthy?
I think it's multi-level. This is sort of the big question that I think everyone is thinking about. We have internal and we have external. So part of it is we think about cultural, and traditionally culture has been thought of as an asset. So really, how do we build on those positive cultural aspects that exist in communities? I think somebody asked about what are some of those assets. So relationships, oral traditions, part of that has been disrupted. So a lot of times people are like, well, people don't know how to cook. Well, how do you go from really cooking and being sort of at the center of food preparation in the United States? You know, so a lot of the traditions, most of the chefs that served the White House were Black in the early days, even George Washington. And then now you go from this idea that you have a loss of cultural tradition. So part of that is restoration. So if you look at agriculture, for example, if you understand history, a lot of the agricultural developments, when you look at indigenous communities or communities of color, then how do people go from growing food to really with this urbanization being in a situation where with northern migration and other types of structural changes that people go to not growing food. So part of this is a restoration of culture. We can't assume that we're creating something new, but we need to understand cultural traditions and legacies. And then how do we work together to restore and facilitate those cultural traditions so people can feel supported? I think the second thing is related to more structural factors. So structural oppression is not cultural, it's oppression. And so part of the adaptation that happens based on oppression, we need to buffer. So I think it's really bringing those two things together, more downstream things like restoration of culture through nutrition education and other types of programs that can focus on the individual and family level. But also, I think, as Jay mentioned, the idea about structural policies and how do we do policy systems and environmental work to really be able to change those structures. You know, we have a significant racial wealth gap that has persisted. So we can't expect that maybe some of our individual level programs, it may have some impact, but it might not have as a significant impact as if we looked at a policy, a redistribution policy when it comes to wealth or change in educational policy. So part of it is those two things go together. One is cultural restoration and resilience, and then really structural, reducing that structural oppression. So it's really bringing those two things together to help support communities.
Can I follow up with that? If there's any, if you have any additional thoughts on just the most effective policies and strategies that you've seen implemented, whether it's in Chicago or elsewhere, to address food insecurities, what are those?
You know, I think it's challenging to think about this in the nutrition space because what we think of as small wins. So some of the policies as it relates to changes in access. So bringing in points of access, expanding access to fruits and vegetables in communities. Some of that has been through food retail. Some has been through subsidies like the WIC nutrition voucher. When you look at the fruit and vegetable voucher that recently has been increased in amounts. There are studies that show that financial incentives can play a big role in helping people purchase. We've seen very positive outcomes as it links to that. But some are small wins. So when people bring in grocery stores, we haven't seen that have the impact that we would expect. So part of it is the multi-layering. And so we need big picture and we need small. We need nutrition focused and we need broader. So you can't really expect that just because you provide food, if people have all of these other structural barriers, that they're going to be able to live a full and healthy life. Some people will. They're just going to push through. But if we want to have population improvements in population health, we really have to create healthy environments for everybody. So how do we partner nutrition policies with economic development policies, with housing policies, all of those things together? And I think we're kind of at that point right now to experiment with those big picture co-benefits of these policies. But we can't lose what you mentioned before. We still need family supports, nutrition education, that help that's culturally responsive, also that may help foster things like economic development. How can we work with communities, for example, parents and families, to not only receive the nutrition education, but to teach the nutrition education? So these can be employment opportunities for people. People know how to teach. You know, it doesn't always have to be outside of the community. We need to look at those folks inside of the community that have knowledge and be able to support the grassroots efforts to make sure that they're at the lead of these initiatives. So the kind of deficit approach where we're talking about, oh, you know, Black and Latinx families from a needs perspective, a deficit perspective. No, we have to talk about it from an asset-based perspective. Culture is a big part of that. If you look at cultural history, it's just a wealth of culture and assets, except we talk about it a lot of times in a deficit, from a deficit perspective. So part of it is thinking about how can we make sure community is at the lead, not in the position where they are just receiving services, but they are in the position where they're creating opportunities for the communities that they live in, that they work in, that they know closely historically.
So follow up to that, because this is one of my favorite things to talk about, just because it's so close to the mission of Common Threads to really be able to deliver a culturally responsive curriculum. So what's being done to respect the cultural food patterns of nutrient insecure Chicagoans?
I can jump in and share some examples from the city side. So I think, you know, one way is as I was alluding to previously, is to center and resource community partners in our funding. And so that can happen in our senior meals. For example, we have food providers for our senior meals who are providing cultural meals to our various populations across the city. It can happen in the larger health equity space, as I mentioned, with the health equity zones, and thinking about how food is tied to walkability, is tied to access to primary care, and thinking about it in a more holistic sense, and then funding those community grassroots organizations to lead that work. And so I think that is largely where we're focused in terms of investments, and then also thinking about how can we work across communities to share learning. And so I think, you know, one of our successes with the COVID racial equity rapid response team is that, you know, the city was there, and the city was working across departments and agencies to resource needs, but community partners were also working with one another and saying, oh, I tried this worked here, I have this asset that I might be able to leverage for you. And so that sort of collective problem solving and co-facilitating that, I think we've seen be very powerful.
So we have a question here. So what can the corporate community do, and what role can they play here? Clearly, there's the financial piece and investment in organizations that are doing the work. And I personally feel that there should be some due diligence around to the point of the organizations that are doing the work in community, and that the community also vocalizes who those organizations are. Do you guys have other thoughts on the role that corporations can play right now?
I think there's also just a larger advocacy piece that sometimes gets lost. I think especially in the corporate space, to your point, it's about, oh, what can we contribute financially? Or we're going to send volunteers, but there's so much around advocacy, and to the points that the panelists are making about policy changes and where money is getting invested. And so if corporations can sort of leverage their reputations, their brand identity to help direct or kind of say, we support this candidate who's for this policy, or we're really supporting putting these resources in these communities. And so I think that like more just advocacy gets often overlooked, because it's a lot easier sometimes to write a check and give money to an organization than really do that larger, deeper work.
I think one thing I would add to that is also ensuring that there is this equity lens, right? And so I think this is something that we are trying to do at the city level, certainly have work to do. But thinking about, you know, even, for example, looking at grocery delivery fees and, you know, how does food equity fit into that if you're trying to improve access to food? And so if you're a private grocery store provider, and I think, so that's a direct food system example, but I think that, you know, there are ways that all corporations can be thinking about and centering equity in their work as they're thinking about how to support the food system. And so I would just add that to what Jessica said, as they're thinking about the different levers that they can pull to come at it with this equity lens.
I think also another way, I would totally agree. A third way that's been sort of discussed is this idea of diversity and inclusion, because corporations have employees, you know, and it's a benefit to corporations also to have a healthy workforce. So how do we use a diversity, equity, inclusion lens in hiring? Part of the reason why we have inequities is based on wealth and income. So a lot of employment. So corporations can also look within their own walls around diversity and inclusion and think more about policies that can help advocate and support the workforce that they serve, and also think about, where do I locate some of the facilities and other things within communities? There's been a lot of move towards that recently in Chicago, in Pullman, where people are located in places that maybe they traditionally didn't realize, you know, that this can be an asset for both this community. It could be a win-win. So how can corporations partner with communities to expand economic opportunities? And some of those can be within the context of the food system.
It's been really interesting to me, given the bird's eye view that I have of different cities across the country, I've never seen anything like what I'm seeing in Chicago with regard to the foundation and philanthropic community. There is a really concerted effort that has just bubbled up during COVID. And you see the foundations and philanthropic leaders in the community coming together to really talk about PSE and what that means in this space, and to really focus in on the south and west sides of Chicago as far as investment goes. Can any of you speak to, you know, just to what you're seeing there, and maybe provide some thoughts for some of the other individuals that are on this Zoom right now, just as far as lessons learned and what you're seeing? And I know, Jay, you've been part of a lot of those, certainly a lot of those conversations too.
Sure, yeah, I can jump in. So I think, so yeah, you're totally right, Linda. We are, I think, very, the philanthropic partners in the city are wonderful. And I think that one way in which we can maximize impact, or that from the city side, we've felt we've been able to maximize impact, is working very closely with our philanthropic partners and our grassroots organizations on the ground to understand where, no pun intended, we can get the most bang for their buck. So, you know, as much as the city does invest in various ways in the food system, there are certain restrictions, and we're not always as adaptable or nimble as perhaps we would like. And so partnering with philanthropy to understand, you know, where are their gaps, where is there flexible or more expedient funding needed, and how can we work together with these grassroots partners to understand what are the emerging needs that need to be addressed most quickly, and what is, you know, how can we partner with community with that asset-based approach that Dr. Odoms-Young said, to think about how to do that. So I think that, you know, that's in the food space, but in other spaces as well, but really thinking about the funding ecosystem and how to best leverage the different pieces, I think, is where we've really seen some innovation and success in the last year.
So I have a question from Marcia. How would you like the medical community to partner with you in this work? I certainly have some thoughts, but I'm gonna throw it to all of you first.
Definitely, the medical community is sort of at the center when it comes to payment and health, or, you know, when you look at the expenditures, a lot of it is in the context of sort of our traditional medical system. But many people, including in Chicago, like the Alliance for Health Equity, they have kind of moved beyond this idea of just treating disease, but to look more at communities as it surrounds, you know, like Westside United and others, of how do you invest in the community. I mean, I'm at UI Health, which is part of the Alliance, but I think that most hospitals are starting to think about how do you invest advocate with the project we're involved in at Imani Village. So this idea of how can you get outside of just the walls of the hospital and really focus on the community for population health. And then maybe, I don't want to say from a more direct service standpoint, but if you look at some of the housing and health pilots that are happening here in the city, or the fruit and vegetable prescription programs, the medical community can play a role in multiple ways, both with patients directly, but in the surrounding community, to look at economic development and other types of opportunities as it links to population health.
You know, it's interesting. Earlier, Dr. Odoms-Young, you talked about really thinking local. And I think about one of our board members, Dr. Ed McDonald at University of Chicago. We're doing a pilot program with him in in mixed income housing in Oakwood Shores. And through, you know, Dr. McDonald has been training barbers to be health advocates and training them. So when they're having conversations with their clientele, and, you know, I tell my hairdresser might as well be my therapist, but these similarly, you know, that's the person you talk to about what's going on in your life. So he's teaching them how to respond and talking about prevention and how what you eat matters just as much as going to the doctor. I thought that was really interesting. Building those relationships, you know, within community, building that pipeline of champions for health, I think is really, really important. We've been in Miami and South Florida, we've been training dietetic interns and students to actually deliver our programming in the park districts. You know, that's been really, really great. We've been teaching a culinary medicine class at Northwestern Osher Center and for credit, and then deploying those medical students into the schools to sixth graders, because they should be communicating at that sixth grade level. And it's been great all around for kids to see these young doctors and get comfortable talking with them. And also it's certainly been great. And we have a lot of interns that are now working with us. So certainly if you're within that healthcare space, I think there's lots of ways that you can support organizations like Jessica's and like mine. I mean, Jessica's doing some really interesting work around actually measuring BMI, which we have done, which is not an easy thing to do. So, you know, as far as organizations like ours don't have the resources to actually do those longitudinal studies where no one's answered that magic question about what's the right dosage, how many hours does it really take? And you can take that one, Dr. Odoms-Young, but I mean, I think we're all trying to still understand what that means. So yeah, I don't know, Jessica, if you want to add anything to that.
Yeah, I think to the point around like outcomes as it pertains to health, there's so much also just inequity in evaluation, and what are we saying is, you know, the right outcome, what is going to prove that a young person gained something from the program. And especially in this work with young people, you're in it for the long haul. You're not going to see those outcomes happening right away, right? Again, we're looking to build lifestyle habits and choices, and again, build up sort of the confidence and character of our young people, and that's not going to happen over time. So I think something that we look at is from a physical activity, we're looking at some survey questions around how young people perceive healthy choices, like what are they choosing in terms of food, what are their families saying that they're doing. We also measure aerobic capacity in terms of the pacer test. If any of y'all have done that, the beep test, it's not fun, but that's sort of what we've been using. But I think thinking about the larger just kind of nonprofit space and evaluations, I'd love to try to move away from those very specific, like, oh, if a young person can run X number of laps or has a BMI of X, that means they're healthy. I think that health looks so many different ways, and it means so many different things. And so to the point, just to back about the medical community, I think it's, again, that destigmatizing going to the doctor. And for so many of our families and young people, there's just not access. And so the more that, I think Dr. Odoms-Young, you were talking about going into the community. So I think the more that we can bring folks in to spaces where our families and students already feel safe, right? Like going to the doctor may not feel safe for our young people and their families. So how can we bring those professionals into those safe spaces and help create that relationship?
I have a question from Amy. What kind of assets should the community support programs focus or highlight?
I know I talked a little bit about, cultural assets and traditional types of um, a lot of times we think about structures outside of communities, but communities traditionally have structures. They have beliefs, they have ways of knowing, ways of doing things. So part of it is hard to say universally, like, okay, this is the asset in this community, or this is the asset. But there's a lot of levels. One is like physical assets in communities. That's the first thing. A lot of times people want to come in communities and we want to create X. Well, first is really seeing what's in that community that you can work with people to build on. Also, a lot of times we bring programs into communities. Okay, what are people doing? So you might have a mother that is, that sees an issue and they're like, okay, I'm going to solve this issue. And they might be solving it within their social network. How do you build on that? Because part of the issue is that when people see problems in communities, they may have the idea, but they don't always have the resources. And I think Jay talked about this, like maybe it might be small scale. How do we scale some of those indigenous models up within communities that people, and in this case, I'm using indigenous as people that live in the communities. How do you scale up some of the ideas that people already have? Those ideas are assets. So part of it is doing an asset assessment in addition to a needs assessment. What are needs? Poor diet, BMI. We're looking at things from poor health, but what are some assets? What are people putting in place? What can they do? What kind of institutions are they building? What kind of families are, as far as block clubs, for example, is a key asset where people are working within their communities to make change. A teacher in a school, community health workers, all of these are assets when we think about human capital and people that are engaging, businesses that exist, that might be informal. How do people share culture? All of those things are assets that can be very helpful.
Thank you. We're going to close it out with one final question. I'd love to hear from all of you. So tell us a lesson learned that's informed your work, how you're working now and how you're going to be working going forward.
Sure. Sorry, I can start, Jessica. Sorry, I just saw you come off mute. So I think a lesson learned that I would lift up, which is sort of building on what Dr. Odoms-Young was just saying, is not coming and knowing that, or thinking that you have all the answers, and really working with the end user to identify needs and think about the best way to meet those needs. So, as I said, I think that was a model that we saw be incredibly effective with the mayor's racial equity rapid response team and what we're trying to build on through the Healthy Chicago 2025 plan. And so, yeah, I'll leave it at that.
I was going to say that obviously many lessons learned, but I think for us, we had to figure out how to take a soccer team-based sport and make it virtual when young people were in a home by themselves with possible limited space. And so I think our team, there's just so much innovation, and we saw that to what other panelists have referenced, what Common Threads has done. And so I think the lesson learned is just that we can all still stay, true to the objectives that we have as an organization, to our core values, but really innovate and be really flexible to meet the needs as they come up. I think we've always had that ability and known we could do that, but when we were sort of put, in the position to have to, so that's a big lesson learned for us, is just to continue to innovate and be as responsive as possible.
Yeah, I think I'll build on that as far as continuing to be humble, because part of it is, oh, can you hear me? Continuing to be humble. So we know that the work is long and slow. Part of it is thinking about how do we may not see, I think someone mentioned that you may not, I think it's a phrase, like you might not see the garden in your lifetime, it's something like that, in the sense of we may not see all of these changes in our lifetime, but the key is to just continue the work, and also to continue to pass on. It's important that we train the next generation. I see one of our students, Alex, gave me a shout out, which I appreciate, but part of it is we can't do it alone. We may think that we know a lot, but we really haven't seen sustainable change. And so it's important that we continue to grind, just to continue to grind to try to make the changes. And I've learned that in the difference from starting at 20 in nutrition and now being 50. I'm like, we really haven't seen as much as I thought at 20. I thought I knew everything. But now at 50, I realize that the work is long and slow, and we make incremental changes by working together and preparing for the future.
In that spirit of it takes a village, we, on behalf of all of us at Common Threads, we're so grateful to have you three and you as well, Dr. Jackson, as part of our village and family. It's really amazing to have such incredibly smart, bright women to be able to have them on back call. And when we talk about collaboration, as far as I'm concerned in Chicago, it's not just talk. There's the walk is happening and the collaboration's coming together in a way I haven't seen in a very long time. It feels somewhat like a new guard, a new day, if you will. Jay, I credit all of the work that you are doing with your team and for being also so responsive and allowing us to really have a voice in your work and lifting us up in a way that when you say, how can I help? How can I support? Actually doing it. So, and so with that, I just want to thank again all of you for what was a really meaningful and thoughtful conversation. A million thanks, and thank you all for joining us today. It was a great group from across the country, and again, hope you all enjoyed the discussion and hope to see you on our next panel discussion.
Thank you. Thank you so much for the invitation.
Thank you. This was wonderful.
Thanks, everyone.